All right, good afternoon, everybody. Thank you for being here. Today we'll have nurse midwife as our career event. But before that, let's do a little check-in. As you know, you need to check in so that teachers know that you're here. And if you have questions, this is a great questions document that you can reference to. And an evaluation form. This is how we give you attendance and credit. And this is a requirement for you to graduate in Oregon. If the QR code doesn't work, we'll have the bit.ly link in the chat. Be fully present, pay attention. This is a good time to ask the questions. And again, submit your evaluation right after the event so that everything is still fresh. And this is for attendance. And let's have Bridget and Naomi.
Okay, I'm going to start by sharing my screen and then we'll introduce us. Can everyone see that? Yes. Okay, great. So today's topic is the certified nurse midwife. And I myself, Bridget Lee, am a certified nurse midwife. So that's what CNM at the end of my name means. And then the MSN means I have a master's in science of nursing. So just explaining what that means. And then I also have down on the screen, you'll see, maybe Naomi, you can give a little hands high five. Naomi Sheff. Naomi Sheff is a current student in the OHSU midwifery school program. So remember, I'm kind of already a midwife and Naomi's working to be a midwife. And I am one of the teachers in the program as well. So this is just a picture of me outside of our labor and delivery floor saying hi. So at OHSU is where we are. So I practice as a midwife. I work there. I'm one of the providers, and I also teach there. And Naomi is a student at Oregon Health Science University in Portland. We are part of the School of Nursing. Okay. There's 12 when it says faculty CNMs, that means teaching midwives. Think of it that way. Sometimes that word is confusing. And we are a teaching program, which means we have, 12 of us who all practice a little bit. So we have patients we see, and then we also teach new midwives to become midwives. And in each class, or we call them cohorts, there are 10 to 12, sometimes a few more, midwifery students at a time. Okay, here's a beautiful picture of OHSU. This veranda, you can eat lunch, and it's really beautiful if anyone's been there. So what is a nurse midwife? I'm going to show this quick little video, and it just kind of explains a little bit more about what a midwife is and a nurse midwife. Oh, well, you know what? Maybe it didn't play. Can you hear it?
Midwifery.
Midwifery.
Is that right? Midwifery?
I don't know.
Midwifery.
Midwifery, yes.
Is that like a female in her 30s? Like, I don't know, married woman?
I know they help during the birth of a child, but that's pretty much all that I know about it.
A midwife can also, I know, like provide some pain relief in terms of like breathing exercises and things like that.
I think midwives work in a hospital.
Some are in hospitals, some are at home.
I don't think they work in the hospital.
Midwives are everywhere. We're in the home, offices, giving prenatal care, giving family planning care. We work in hospitals. We work in birth centers.
Most people, when you think of a midwife, you just think of somebody who helps women have babies. But we do a lot more than that. We work with women throughout their life cycle.
When someone comes to see a midwife, they often wonder about what we can do for them as far as pain management, as far as medications. They're worried that if you're with a midwife, you can't have an epidural, for example, which is not true. I think a lot of people are surprised to hear the level of training and education that is required to be a midwife in the U.S. because midwives do so much more than just birth.
We provide personalized care.
reason I chose a midwife is because I wasn't a number. I was actually a patient. I was actually a person with feelings, and they were going to devote the time that I needed to answer all of my questions, address my concerns. They want you to make, good choices for you and your unborn baby. I'm so glad that I chose a midwife. It's definitely an ongoing relationship.
Midwives have reduced the cesarean section rate in this country. It's overall been drifting up in the range of 30%. The midwife practice here at GW has a cesarean section delivery rate of 5%. Physicians plus midwives is a way of putting together a collaboration that responds to what the patients want. Doctors should advocate for the midwives. I enjoy the sharing, I enjoy the collaboration.
I chose a midwife because they are trained to deal with birth as a normal process, not a medical emergency. I plan to use a midwife for the rest of my life for my healthcare needs. I trust them and know that they have my best interests in mind, and that's really important to me.
As midwives, our philosophy of care is based on respect for women.
We put the woman and her family at the center of the care and then build up from that.
We collaborate together. We're partners.
I think all women deserve a midwife.
Every woman deserves high quality, evidence-based, personalized care, and we're here to make it happen.
Great, so that's just a little video that gives you a little more of idea of what a midwife is. And the truth is, in the beginning, when people are saying midwifery, that happens a lot. It's a hard word to say. So the confusion is very normal. So when I'm thinking about the word nurse midwife, I made this slide to kind of show you the difference between a nurse and a midwife. And I think it just kind of separates out kind of our roles, what we do, what makes us different. So if we have the title nurse midwife, it means I am a nurse, but I also have an advanced degree in midwifery. Okay. There are other types of midwives who are not nurses, and they would be called certified professional midwives or just a midwife. So there are other types of midwives you might hear about. Today, we are talking only about what Naomi is going to be, what I am, a nurse midwife. So a nurse reviews and follows orders written by prescribers. And then if you look right across, the midwife could be the prescriber. It often is. So in the state of Oregon, we write prescriptions, we practice independently. So you can kind of read through these. I won't go through them all. But we work closely with a nurse, right? So all of our patients also have a nurse taking care of them. So this gives you a little bit of an idea. The picture on the left is one of the group prenatal cares. I run group prenatal care. So all of these moms consented to be part of this and were pregnant at this time, and a student was also there. So full scope midwifery care. So what do I do? So I take care of people from across the lifespan. The earliest, age 12, 13, give or take. And I have a patient this week who's going to be 65. So a very wide range of women. So we take care of low to moderate risk pregnancy. We do prenatal care, often group prenatal care. That's just a type of prenatal care. And that means you come in for your checks when you're pregnant every month or every couple of weeks. And you see us in the office or clinic setting, just like you'd go to a doctor's office, you'd go to your midwife's office. We also do postpartum care. We take care of people after they have the baby. We take care of people while they're having their babies. And then we take care of them if they would like family planning, which would mean IUDs or any type of contraception or birth control. We can do full GYN care. So people come in the office for all different things, yeast infections, urinary tract infections, anything that might be female related. We take care of menopausal care. So really kind of, if you think about it, we're almost like a family practice. We do primary care as well as we specialize in pregnancy and birth. We do some male care as well. We'll get that question, especially if you work at Planned Parenthood. There are rules and regulations in the state of Oregon, but depending on what state you're in, you can take care of males and you can prescribe partner treatment for things. and trans care. Midwives are really getting more interested in this, I would say. We have a whole trans clinic at OHSU, and some of the midwives are hoping to be able to work in it. So talking a little more about intrapartum care, we use that word, really that means when people are in labor, okay? And it really means in that we only work in a hospital setting, right? In the video, they said midwives could work at home births or birth centers, but where we work and where Naomi's training is in a hospital setting. So when we say intrapartum care, it means once they're at the hospital, they think they're in labor, or maybe they're coming to see if they're in labor, or maybe they think their water broke. Once they walk in the door, they will call me first. I have a pager. My pager will go off. Oh, this patient's calling. I'll say, oh yeah, I think you should come in. They'll come in the door and I meet them at the door and we take care of them until they leave. So the midwives will take complete care of them. We help with the birth. We do suturing, and then we follow them postpartum as well. This is a picture of me and people who work at OHSU who had a baby who would love to be part of things, but just showing how we are part of their postpartum experience as well. So you don't just like give birth and say bye. You take care of them even for their whole life. I like to put in a few little public service announcements in my talks just to educate people. And a lot of young people don't know some of this because it's not common knowledge, but breastfeeding prevents breast cancer and other female cancers. It also reduces the risk of SIDS, which is sudden infant death syndrome, infections, and obesity and asthma in infants. So we are proponents of breastfeeding. And then the other one is if you are of childbearing age, whenever you have unprotected intercourse, you're planning a pregnancy. And that always kind of makes me laugh, only because people don't think of it that way. But it is true, right? So as midwives, when people first come in and they're pregnant, I'll always say, was it planned, a surprise, unplanned, welcomed? But I think as midwives, we do think about, our own reproductive choices and how important they are and kind of like having ownership of your body. So what does a typical work week of mine look like? I usually have one 8-hour clinic day, and that means office day, where I see patients who are scheduled to come see me in the office. And then I do 1 or 2 12-hour call shifts, and that means I'm on the labor floor. So that would be called inpatient care. And I'm on the labor floor. Whoever's in labor gets me that day. And then we also have some meetings because remember, I'm a teacher in the program. So we have some teaching. So usually 36 to 40 hours a week. There's always extra things, but the annual salary of a midwife, people often ask this, it's a pretty big range. I think for new midwives in cities, just in general, you get paid a little bit more. So the starting rate for like a new midwife in Portland is probably 110. And then people who've been midwives for a while easily make in the 160s to 200. Sounds good, right? So now I'm going to let Naomi take over. Did I go ahead of screen, Naomi? I might have.
Yeah, I think you might have.
All right, let me go back. I'm going to let Naomi take over and talk about kind of like, hey, this career sounds good. How did she get here? And what are her classes and all of those kind of educational details?
Yeah. Hey, guys. So my name is Naomi. I use she, her, and they, them pronouns. And this is a picture of me and a puppy, which is not our patient population, but I think that was in nursing school. Next slide, please. So my background is in lots of different things, and this is really just to illustrate that you can arrive at midwifery from a lot of different places. So I was a religious studies major when I was in college. And that was really kind of a great place for me to start because I wanted to know how people made meaning out of their lives, how people make community, and I wanted to kind of think about the social world of that. I also was a farmer starting when I was in high school. So I did farming and gardening and orchard work and food justice work for maybe 10 years before I went to nursing school. And when I was in college, I got really into Chinese medicine. And I was getting acupuncture myself. And then I also started thinking, hey, maybe I want to work in medicine, but I want to do something that feels holistic, that kind of cares for the whole person. I don't want to just prescribe a medication for someone and send them out the door. And I thought Chinese medicine might be a really nice way to do that, you know, acupuncture and herbs. So I started working at a clinic, and everything having to do with pregnancy or hormones or later life care like menopause, I just loved. And so I realized I could do that all the time and kind of go in the midwifery direction instead. So I started dipping my toes. A really nice way to do that is to work as what's called a doula. So a doula is kind of partners with the midwife in a birth, but is a very different role that people might have heard of. Really, the main role of a doula is emotional support of the person who's pregnant, and also sometimes physical support, logistical support, kind of getting things sorted out, working with people's partners. So you're kind of like a birth buddy. So I did that kind of full spectrum. I was a birth doula, and I also was an abortion doula. You can kind of do both. Next slide, please. So Bridget, did you want me to chat through this stuff? I'm happy to.
I think so. I think it's important. Yeah.
Yeah. So the path to becoming a midwife starts with high school. So maintaining a decent GPA, so A's and B's are totally acceptable to get started. It's really great to work with people, you know, kind of starting to think about college, you know, to reach out to schools you might be interested in, or to chat with people that you know who might be older, like siblings, friends who are in colleges that you're curious about. And that can be a great way to start imagining and thinking about, you know, what do I want out of college? Which college should I go to? And in healthcare, leadership and teamwork are big pieces that we're all practicing all the time. So starting to dip your toes into the role of being a leader and working with teams, like, you know, volunteering on different projects or playing sports, all of these things help practice those skills. And I really encourage people to do that in the, you know, the kind of projects and environments that you're really interested in, because you can work on those skills really anywhere. And then the next step is to get your essentially a college degree. It's called a bachelor's of science in nursing. And that you can do that a couple different ways. If leaving high school, you know, hey, I want to become a nurse, or I want to become a nurse midwife, you can go straight to a school that does that. You can also go to college for something totally different. Like I did religious studies, and then there are these accelerated programs, these faster track ones in nursing that only take about a year and a quarter. So that was the track that I took. So in those programs, you study all the kind of basic different sciences, and we end up using all of these in our actual medical practice.
Another route I'll just add on would be, you know, going to like a 2-year nursing program, and then you would you could kind of get your feet wet. And so some people do that as well. And then they get their BSN, and then they come to midwifery. Yeah. So there's a lot of different routes.
Yeah, so some people, like Bridget said, will work as a nurse for years before they become a midwife. And then others, like myself, I went straight through school. So you can really do both. So when you're applying to nurse midwifery school, a couple steps down this line, we really like to see that people have some experience with pregnancy or birth, just to get a sense of, you know, what does this work actually look like on the ground? So, you know, you can be a doula, like what I did, and support people who are pregnant. You can be a medical scribe and get a lot of experience in a medical setting by being the person who documents visits with patients. You can do different volunteering. You can do trainings to be an instructor for childbirth. And then the last step is really to, once you've gotten your nursing education, take an exam called the NCLEX, and that's what's finally going to get you your nursing license.
And I'll just add on here, we offer, you know, I think this list of like, oh, these are things you should do, right, can seem kind of daunting. One other thing I would recommend is getting shadowships. You know, if you're interested in nursing or you're interested in midwifery, you can reach out and get my email and Naomi's, and we are more than happy. There's a few, you do have to have your vaccines, and there's a form we fill out to get people to come through OHSU. But, you know, if Naomi's on a labor call shift or I am, I love having shadows. I think it's really, really great just to kind of come for a day, watch what we do, see, do I like to work with people, or would I rather work with computers? Or, you know, just to learn about yourself. And I think that that is something, you know, when talking about equity with students, that some students don't feel like they have an open door for that. But we want to, part of this talk is that we want to offer an open door to anybody who might want to have a little glimpse in what our life is like. So feel free to reach out if you're interested. And obviously people who are motivated and really interested.
Yeah, absolutely. So the next step is to actually study midwifery. You can do that with 2 different degrees. So one option is to get your master's, the other is to get a doctorate. They have the same scope of practice, same job in the end, but the doctorate gives you an extra year of school. So you have a 2-year or 3-year program. And involved in those programs is classes. So a lot of classroom time, a lot of studying, clinical experiences in the hospital and in the what we call outpatient, so like going to the doctor's office and midwife's office setting. And all of, you know, the classes and the clinic time are mixed throughout the whole program. So we're studying and applying it.
Tell us what your day looks like right now, Naomi, like in
Totally.
or your week, I should say.
I have a slide on that too. I think it's the next.
Oh, you do? Okay. Oh, good. Okay.
Maybe it was earlier and it got skipped. I don't know, but happy to talk through it. So my day or my week really looks very similar to Bridget's, but in the learning role. So I have that one day of clinic where I'm seeing patients more in like an office clinic setting. And I have those 2 12-hour call shifts. So for that, it looks like, you know, having the same schedule as a midwife and going to the hospital saying, this is what I want to work on today. We talk about what patients are there and coming in. We make a plan for the day. And I essentially do as much of the job as I feel ready to do under the guidance of the midwife. And the idea is that at first we're more watching, shadowing, and then eventually taking on a lot more responsibility. And then every week I have classes to actually get me ready to do these things.
So it's a full-time job
Definitely
to be a student.
job. Yeah, and lots of studying outside, lots of reading.
And so I'll add here too, there's many different, I think there's about 30, don't quote me exactly, but 30 different midwifery programs in the United States. So you could go to many different places, right? Something that makes everyone the same or similar would be the certification exam called the boards. So no matter where you go to school, at the end of your midwifery education, you take a boards exam. And that's what gives you the CNM after your name. Yep. Oh, here we go. Here's your journey. Yeah. But yeah, go through this part. Yeah.
Oh, this is just to outline. I color coded it because that always helps me. It's just to say you can have a really windy path to get here. You know, these green ones are more traditional education pieces. Like I did my prereqs at community college here in Portland. I did the accelerated bachelor's of nursing at OHSU, and all of that helped me get ready. But I also worked and traveled for years after after college. And, you know, got my adventures and got my life experience started. And I also worked as a couple of kinds of doulas. And all of that is really part of the path. So you can be very creative for how you arrive here.
And most of our students, I would say, are, right? Almost everybody has a different path to it all.
Yeah.
Okay. And we're about to wrap up, and I can't see in the chat if there are questions, but let's watch this little video and then or maybe we won't. Yeah, let's see if it works.
It's a self-motivating, powerful calling to be a midwife.
I didn't choose midwifery, midwifery chose me. Catching babies is holy work, sacred. It is this incredible collision of science and poetry.
What I want to bring to my community is another option for women.
I absolutely love the women and the connection.
It's what a midwife is supposed to be with women.
Remembering that this belongs here.
We feel that we are the gatekeeper for normal birth.
As a midwife, I go to a birth with more than a shoestring and a towel. Then I'm an educated woman.
If you're going to be a midwife, you got to know what you're doing. Midwifery says is that we want healthy mom, healthy baby, healthy process.
I teach them about their bodies, to be comfortable with their bodies,
Telling women what to expect and what can happen. And that's all important, but I think it's also important to listen. Looking into somebody's eyes and being there and knowing like, we got this, I'm with you, sister.
Being one-on-one with women and really valuing the experiential part of the process for them changes the picture.
We sit with women, helping them find their power, their road, their path.
Really? You can't just tell? People just can't tell how valuable it is?
Some of our good statistics come out of caring for her experience, because when a woman feels safe and relaxed and confident and supported, her body will work better.
The research clearly is showing us now that that is really right on. That the health and safety of birth is strongest. It's at its highest potential when women get to be themselves.
And the World Health Organization has asked that we put midwifery on the agenda because of the value, the incredible value that comes from midwifery care.
Connaît tout signe qui gagne, yo connaît toute technique, yo connaît toute technique pour employer pour sauver la vie maman avec ses bébés.
Midwifery care needs to be available for every woman who wants a midwife.
I know that natural, holistic, physiologic birth can be a catalyst to changing women's lives, because it changed mine.
So questions, does anyone have questions? And I'll stop sharing and we can be on the.
Yeah, so there's one or two in the chat so far. And students, if you have more, feel free to put them in there or unmute your mic. So one of them is it more common to go directly to midwifery after nursing school, or is it more common to follow other paths, like stay being a nurse and then go?
Yeah, great. I think my answer would be it's 50-50. Like, what would you say, Naomi? Yeah. I mean, at OHSU,
I would say it's pretty half and half. I think while more people are learning about midwifery earlier on, we're seeing more people go directly through instead of working as a nurse. But definitely, like in my class, we're maybe 2/3 straight through school, 1/3 working as a nurse beforehand.
Mm-hmm. Yeah, great. And I would say I was someone, I didn't tell you my journey, but at a young age in high school, I was able to shadow a birth provider. And I was like, I love birth. I'm so interested. And I knew in high school, like, that's what I wanted to do. And so my path was pretty smooth and quick. I was never a nurse, practicing nurse. What else? Can volunteer be present during childbirth? You mean a volunteer, like a shadow person? Yeah. Yeah, we're at a teaching institution at OHSU, Oregon Health Science up on the Hill. And all the patients who come, when they first come to us, when they're pregnant, they're kind of consented for learners. And then we ask as well for watchers or learners or shadowers. But I would say we have a pretty high rate of acceptance. So yeah, if you shadowed on the day and there was going to be a birth, yes, we wouldn't want you to just come in at the last minute. Right? We'd want you to have met the birthing person and be involved a little bit just by having shown your face. But yeah, absolutely. And then the next one was, what was the huge difference between midwifery and doulas? And Naomi, I'm going to let you tackle that.
Sure. Yeah. So both a midwife and a doula attends the birth, very different roles. So the midwife is the medical provider in the room. Like Bridget said, they're prescribing medications, but they're also kind of tracking the process of the labor and the birth and making changes as needed in the care. And they see people in that pregnancy prenatal phase and also after the baby's born. The doula is really there for emotional support, helping them labor, helping them deal with the pains of contractions, things like that, thinking about different positions to be in for when they're pushing, things like that. So they also work with people in that pregnancy period and when after the baby's born, and they're there for the birth.
So the doula is more of a supportive role, whereas the midwife, like we are the provider, we have a medical legal responsibility to the patient. The doula does not. So a doula is more like a friend or someone who you feel comfortable. A doula could be anyone, right? There is doula training you can do. And I think Naomi said that, you know, she had done, there's a very specific doula trainings you can do. And there's a lot of them in Portland. And I don't know if there's an age limit. Like I think you could do them in high school.
Some of them might be 18, but
18, yeah, so maybe 18, but you'd also probably have to you have to attend some births and get some experience. But yeah, being a doula is a good way to just see, do you like to be around birth? Does birth excite you?
the
But
training for a
midwife is
doula
really
is like,
different.
it's like 10 weeks to become a doula. You know, it's really a short training. So it's a nice way to just check it out instead of committing to a 3-year program for midwifery. Yeah.
Right. And so when she says 3 years, she has a 4-year degree before that. So 7 years total. Right. And that was similar for me. I think I was 7 or 8 years. So it's a completely different job and completely different role. A lot of our patients at OHSU hire doulas just for some more support. And a lot of the doulas, a lot of our patients, more than 70% probably, and a lot of the doulas will labor with the patients at home before they come to the hospital. So the doula might call me and say, oh, this is what the patient's doing. Or when they come to the hospital, the doula will help them with breastfeeding afterwards and things like that. But we welcome doulas. We work well with them. And what about the bottom question? Can you read that, Naomi? What high school courses would be great to take now if I'm interested in this career?
If you want to be a midwife, I would say the first thing that I would start studying is just people. You know, you can get into the sciences in nursing school. I wouldn't worry too much about becoming a scientific expert now. Great if you're excited about biology classes. Certainly take
sociology, right? Sociology, anthropology. Yeah.
Right. Yeah. Well, that would be more college level, but
I guess
you can take like social studies classes or history classes that get
but
you
definitely science classes too. Like you'd have to have the basic biology and the basic physics to get into a college program.
If you can do like a semester or 2 of biology and a semester or 2 of chemistry, that'll set you up really well. Yeah. So a little bit about
what are the most and least rewarding aspects of your job where you're training, Naomi?
Great question. I mean, the most rewarding is just getting to be with people in these major life transitions. This is a really tender time we're talking about. You know, people are becoming parents for the first time, or they're figuring out, you know, how to be pregnant and what that's like. And also we do work with people throughout the lifespan. So just getting to be in a pretty intimate, personal space with people, I think is, you know, what drew me to it and what I love about it. Least rewarding, I don't know if I would phrase it that way, but you know, there's some lifestyle stuff that can be hard. Like people give birth to babies at any time of the day or night. So we work, you know, day shifts. We also work night shifts. So, you know, it can be hard on sleep, and then I catch up on sleep after a shift. But you know,
or like I went to a birth at 2 a.m. and now I'm here.
Right. Last night.
Just what you do. Yeah.
Yeah. Totally.
Just what you do. Yeah.
Yeah.
So you're right, time management maybe and kind of life. And I think also a little answer I would add to that is I think everyone thinks of midwifery as it's so joyful. And like, you can just see, like, I love what I do and I've been doing it for 15 years, but it's also really hard. And it's not always positive, good. Bad things do happen. Right. And so you have to kind of be ready to deal with things that are really hard life events too. So it's not all rainbows and happy. So sometimes that can be really hard.
Yeah.
What's the outlook for this career? Yeah, that's really good. And you know what? There was a slide that we missed, and it was the last one. Do you remember, Naomi? It says, like, why do we do this work? Part of that.
Right.
There's a slide that just shows, you know, the infant mortality. So how we look at, you know, how our country is doing basically in women's health. One of the markers is looking at infant mortality. Like if someone's pregnant, what is the likelihood that that baby is going to be born and live for 1 year? We look at like mother mortality as well too, how many women can give birth and live through it, right? But the point is, the US, our numbers are not good. They're really mediocre. And I could go back and find that slide, but you can also look it up. You know, compared to Japan and other developed countries, we're really not doing a great job. And so a lot of the thinking is, you know, yeah, there are midwives and people who live in cities have access to good obstetrical care, but most of the country doesn't, right? And there are people on all sorts of the margins that aren't getting the care they need. So we need more midwives. Also, yeah, that's a longer conversation, but basically it's not hard to find a job in midwifery either. You know, now it depends where you want to be. In Portland, it's kind of hard because there's a lot of midwives in Portland. Every hospital you've heard of in Portland has midwives, every hospital. So it's pretty competitive and people want to live here and work here as a midwife because midwifery is really, really strongly supported here. But Naomi, wouldn't you say, like, if you look across the country, if you're willing to move anywhere, there's lots of jobs.
Definitely. Yeah. And the scope, you know, the kind of outer bounds of what a midwife can do have expanded a lot. So we do work with people, you know, kind of all across the lifespan. So we can work at Planned Parenthood, let's say, you know, kind of, you can do a birth focused job in a hospital, but you can also do lots of other things.
Yeah, exactly. You don't have to just do birth too, right? There's at the Planned Parenthoods in Portland, they're almost all fully staffed by midwives. Yeah, so there's a lot of different options. You know, you could work doing birth for 10 years and then decide, okay, now I want to work in the clinic only, you know. Yeah. Or you can teach and work like I do. And then where can we apply for shadowing? I would say ask Goldie and Catherine, you know, reach out to them for my email. And then if you're really interested, we'll have a little conversation and I can get you the paperwork and get you set up. The COVID vaccine is you have to have, I don't know if you have to have the booster, I'd have to look, but you at least have to have 2 doses of that and a few other things too. So, but yeah, great. That'd be fun. Any other questions?
I think there was one that we missed.
Sorry.
What is the biggest difference between a nurse midwife and a labor and delivery nurse? Or did we talk about that? I don't remember.
You know, we talked about when I had that slide that said nurse and then midwife, but let's reiterate it. Let's talk about it again. Naomi, do you feel like?
Sure. Yeah. Feel free to add any thoughts too. But so similar to the doula and the midwife, they're both on that birth team. So is the labor and delivery nurse, but still a very different role than the midwife. So the midwife, like we said, is the provider. They're the one who's kind of tracking the whole birth, managing the medications, managing any of the medical changes that need to happen. And they're ultimately responsible for the outcomes of the birth. The labor and delivery nurse is enacting a lot of those changes. So they're kind of, you know,
so practically, like, they're checking the blood pressure, they're, you know, emptying the urine if they need to. They're doing a lot of physical skills.
Physically giving the medications that are ordered.
Yeah, doing a lot of charting and keeping track of the temperature and all of these things. Whereas the midwife, we're more managing the big picture of it. We do write our own note, but I might ask the nurse, what was her temperature, right? I probably wouldn't check her temperature. I could, but you know, that wouldn't really be, that would be her thing. Or running the IV pumps in case someone needs some IV fluids or they decide they want an epidural or they need some Pitocin, something we use sometimes. The nurse would manage the IV pole and the medications in there, where we would say if the patient needs them, then the nurse would be kind of implementing them, if that makes sense. So yeah, we work very closely together. And like Naomi said, a lot of midwives used to be nurses. Like maybe they were nurses for 10 years and they said, okay, now I'm ready for the next role. I'm ready for the step up. I'm ready to, like, you know, actually catch the baby and do the suturing and things like that.
Another thing I'll add is that the nurse only has that one patient. So they're really one-on-one with them. And for their whole shift, that's all they're responsible for. And the midwife, maybe we have multiple patients, you know, on the unit who are in labor. So we'll be popping around and, you know, kind of managing each of them and checking in with everyone. But the nurse really gets that bedside time too.
Great. Anything else?
Well, students, if you have any more questions, put it in the chat. But for Bridget and Naomi, is there any last words of advice that you would like to give the students?
I always tell people when they're trying to think about what they might want to do, I mentioned this, like thinking about, do you like people? Do you think you want to work with people? Do you like talking to people all day? Are you interested in their stories? Or are you someone who's like, no, you know what? I really like computers and I like more of independent individual work, right? And that kind of can help you figure out different career paths and just by your personality and what you like. And not one of them is good or bad, but it's good to know that about yourself. I do think to be a successful midwife, you have to be pretty social and, interested in being able to, midwives that are really successful, they can walk in a room and meet a patient and the patient can trust them very quickly, right? They're really effective with people. They just have a skill for that. And they're interested in people. They really do. They're really interested in people's stories. So that is something I would think about when you're thinking about not just midwifery, but what do I want to do?
Yeah, and I'll just say, I really think it's important to keep doing what feels good. Follow your heart, think about how you're responding to any environment or any person that you're talking with and say, okay, this is what feels good. I want to follow that. And regardless of what that looks like, at one point, you'll end up where you need to go. And I think that's just important at each of those kind of decision-making points. Like, where do I go to college? Check out a couple colleges and see, where do I feel like myself?
Great.
All right. Well, I think that was the last of the questions. Well, thank you guys for joining us today.
Welcome.
Thanks for having us.
Great. So feel free to email us with anything.
Okay, so I'm going to go ahead and stop the recording.